Welcome to the second Personalized Surgery podcast. The goal of this podcast is to get feedback and talk about how globally surgeons across the world are using personalized surgery. We're grateful to have with us today Dr. Nick Hartnell. Welcome, Dr. Nick Hartnell.
Thank you. Thanks for having me.
Dr. Nick Hartnell is a renowned orthopedic surgeon from Australia with 20 years of experience in joint replacement, trauma, as well as oncology. He's done fellowship in China, Belgium, US, and he's leading here at Sydney Macquarie, as well as his private beautiful practice in Barrow. So I'm going to just jump to the questions, Dr. Hartnell. So the first question is, you're in forefront in orthopedics, working with global companies, pioneering newer technologies. We hear a lot about personalization in orthopedics. In your perspective, from patients, what does that really mean?
Well, it's matching the patient's anatomy. We all know everyone's an individual, and it's lovely to be able to match that individual's skeleton or soft tissue, because we want to be able to reproduce their function, return them back to their normal. So that's what I say personalisation is, matching that patient's anatomy that they were born with, and that's the beauty of what we've got now.
Awesome, great. You've been an advocate for innovation, with some amazing projects that you've been doing over the last 10 to 20 years. What are some of the major changes from, when during your early days of using this technology to what you have seen now? What do you think has changed?
Well, the ability to print now is the key. The scanning that you can now utilize, then you can adjust that scan to a model, and then that model to print to have an implant that will match that patient's issue or problem, or be able to recreate it, and the speed at which we can do that now. So the ability to capture that anatomy and then transfer that data, image data, into an implant is the key now. And that's something that we've changed over the last 15, 20 years. That's the exciting part of it.
Awesome. Yeah. So you were one of the early adapters of 3D printing. If you could share some of your cases or some of your experiences where you felt like, this one had a real impact in your practice.
Well, my first custom implant was probably 12 years ago now. I think I was one of the first in our country anyway to start kind of pushing the envelope a bit, getting these custom implants in. And I'll never forget, I had a patient who'd failed hip arthrodesis. He was on strong analgesics. He was addicted to opioids. He had severe pain and had no real options about having his unique anatomy fixed. So what I did back then was designed a plate that would fit his anatomy, get his screws to the right depth into his pelvic floor, and get a successful, stable, united arthrodesis on his hip. I'm grateful to say that we were able to print that, and it did take us 5 weeks, I think, or even 6 weeks back there to get the scans done, the images, and then get the implant made. But once we got it made, it fit perfectly, and we've been able to get this patient off his opioids. He's a local that I see all the time, and he's mobilising and happy. So we've truly made a difference. And we didn't have anything for this patient. He was struggling. He had no other options. We would always have to compromise for his care until we could personalise something for him. So that was my first patient, and ever since then, it's just been exciting to have those challenging cases come to you, and then knowing that you've now got an option. You've got
Yeah.
something that you can individualize for that patient that will help them.
Awesome. That's great. So, I've seen like you use these 3D models, 3D printed models of patients' anatomy. When you show those models to the patient and their relatives, what difference does it make? Has anything changed from how you explained it with or without those models?
It's just educating the patient, and to me that is key for their rehabilitation post-operatively, acceptance of the idea of this operation as well. If you can give the patient a model and then show them their problem, their individual issue, and how we're going to fix it, and what we're going to do with the implants to that knee or hip or pelvis, then the patient really can understand, I know what's happening. When I wake up, I can trust that implant because I've seen that model and I've seen it work. And then the rehabilitation is a much easier conversation because it's all about trust in that implant.
Mm-hmm.
Now, the patient's been educated in it, they've got the trust, and post-operatively, it should all flow through to a very successful result.
Nice. Now, from a surgeon's perspective, intraoperatively, can you maybe share some of your cases where you have used this technology and how it has helped?
Well, the most obvious one and the most recent one I've done is when we had huge bone loss. When you've got huge bone loss, you have to recreate it somehow. Now, either you compromise with your implant because you've only got a certain number of implants, or you augment or you custom make something that will fit that defect, and then allow you to get back to recreating or reconstructing that joint. And to me, it's that bony defect that really is the important and the complex cases that we see that you need this personalized surgery for.
Interesting. So you're basically filling out that bony defect, exactly what the patient had, whatever that bone
Correct.
has. You're just replacing that bone with the new,
correct,
either implant or structure.
Absolutely. And so we need to, if we're going to do a knee replacement or a hip replacement, we need to have stability with the surrounding skeleton. And if you've got bone loss or bone defects, you're not going to get your stability.
Yeah.
So we need to recreate that stability and recreate that structure so we can have a stable implant that will give that patient hopefully 20, 30 years of life out of that joint. And that's what we want.
Awesome. This is a little bit of a tougher question from my perspective. Is 3D technology, robotics, 3D printing. There's a lot of buzz around this. So is robotics really a game changer? And how do you compare this with what you're using?
So, well, the facts of it now is that the robot has been proven in the joint registry that it's no better. Now, I think it's innovation. I think it's exciting. I think it's part of our evolution and our learning. So I don't want to throw the robot out, but I don't equally want to embrace it as a game changer like you've suggested. I think it's exciting technology, but when you look at the technology and how it's been linked to the company-specific implant, one of the biggest sellers is selling one of the oldest joints. And so they have new way of putting in an old joint. And I don't like that evolution as such. I'd rather have the newer joint or the personalized joint that we can put in and perhaps be able to put that in robotically. And I see that as the innovation of the future. Right now, I see the robot as a bit of fun. It's unfortunately marketing as well, but it's not a game changer yet. But I certainly want to embrace innovation and technology, so I certainly want to see it be used.
Awesome, great. For the hospitals and surgeons who want to embrace this technology, how do they go about it? Like, where do they start?
Well, I mean, firstly, I think what they have to do is get used to this technology and get their trust in it as well. I mean, trust in any implant takes time. And any surgeon who's doing a new procedure will take several procedures before they've got the trust in that procedure. So I think they need to start slowly. They need to speak to colleagues. But ultimately, it does come down to a fact that you can have a patient with a problem. That problem is defined with an image. That image can then be transferred into a model. That model can then be transferred into a surgical plan, and that surgical plan can be transferred into an implant. And if you've got your whole lab at the hospital, you can do that within 24, 48 hours. And that's a game changer, because remember also in orthopedics, it's not always elective, so you don't have the luxury of time in most occasions, and so there is some urgency to get that patient into the hospital and give them the best outcome.
Right.
So I think if you've got your own lab, your own facilities, and you can have that process from start to finish when a patient presents, that is a game changer.
Awesome.
That's what I would suggest is the game changer.
Awesome, great. So you've seen the evolution for the last 20 years. Tell us a little bit more what we're going to see in next 10 to 20 years. Like where is the industry going?
I mean, let's talk about evolution of orthopedics and trauma. I mean, that goes way back, and it's all about what instruments and options the surgeon has. If we go back to the First World War, then it was traction. That's all they had. Yeah. And we get to the Second World War, we got some implants for nailing femoral fractures, for example, plating humerus. So the implants started to evolve. There was very rudimentary screws and plates back then, but now that's changed. Then we've got the orthopedic implants that have evolved. So we're getting essentially the metal and the plastic, which we've now got to a point that we know the articulation is great. So we've not solved the problem yet, but we're certainly very close to being able to give that patient an articulating joint which has longevity. But we're now evolving into the custom implants, but custom metal implants. And I think what the surgeons and what the patients are going to want next is not only that custom implant, perhaps put in with patient-specific instrumentation or robotic instrumentation, but they're going to want some biology as well. I think surgeons and patients are getting a bit sick of metal and plastic. They want to be able to reproduce their bony anatomy with something bone-like. They want to reproduce their soft tissue anatomy with something that is soft tissue that the body accepts and utilizes as their own. So I think there's going to be that hybrid mix of metal and plastic, collagen and bone, that I think will evolve to the point that we'll be able to present to any patient a solution that not only reproduces their anatomy, but reproduces their biology. That's what I think is going to be exciting over the next 10 to 20 years.
Awesome. So combination of personalized these metals and plastics along with regenerative,
correct,
that kind of integrates into the body to recreate what was originally there.
Absolutely. And once you've got biological fixation, you've got it for life.
Yeah.
And that's what we want.
Yeah.
We want that longevity.
Awesome. Well, we really appreciate your time, and thank you so much for coming over for our podcast. Thank you, Dr. Nick Hartnell.
Good. Thank you.
Thank you.